More and more young people are questioning their gender.
Being trans isn't a choice. When people see me on the street, I want to be perceived as a woman.
The numbers of under 18 seeking help from the NHS has risen sharply in the last 5 years.
This isn't some frivolous choice that kids are making without thinking about it.
Health professionals are feeling under pressure.
I've become increasingly concerned about the large number of patients who want physical treatment as quickly as possible.
For others, there's no time to waste.
We get lots of children who are already in puberty, who are very distressed, who are saying, please stop me developing any further, I cannot bear this.
There are calls for better regulation of this new area of medicine.
The quality of the evidence is terrible, and we urgently need a new regulator.
Tonight, we ask, do we know enough about the care offered to transgender children?
Is there an impact on brain development that has longer-term implications? We don't have the answer to that.
I'm Faye Kirkland. I'm a journalist and I'm also a family doctor. For young people questioning their gender, GPs can be the first port of call. It's a relatively new area of medicine, and I want to find out how much we understand about the care available. I'm in Leicester to meet Jade.
Being trans, it's not something you choose, it's something you choose to act on. When people see me on the street, I want to be perceived as a woman.
Jade, who's 18, is biologically male. During rehearsals for a school nativity play, she realised she didn't feel like a boy.
I wanted to be cast as an angel, and the teachers said, no, only girls can be angels, and I had sort of flipped out about it. So that was sort of my first inkling. When teachers ask, what do you want to be when you grow up, thing like, what career do you want to go down? And I don't jokingly say oh, I want to grow up to be a girl.
As she grew up, she became more and more unhappy.
Puberty started, and I just felt this huge disconnect. I was growing taller and broader, and I wasn't having any of that, but I never talked about it. I knew that it wasn't right. I sort of knew that it wasn't normal.
Similar stories are shared online by transgender bloggers.
From as early as I can remember, I have always felt incorrect.
Puberty basically made me feel like there was something really wrong with me.
I would scream at the thought of not being able to be wearing the clothes that I wanted to wear.
Gender dysphoria is a feeling of intense distress around a physical body that doesn't fit in with one's sense of one's gender identification. It's a profound experience for many young people and is exceedingly distressing.
Holly Carmichael runs the only NHS service offering child gender medicine to under 18s in England and Wales. Based at the Tavistock Centre in London, she sees many young people with gender dysphoria.
Often young people will wish to be rid of the secondary sex characteristics or are afraid of them developing, if you like, which don't match the sense of themselves.
With the onset of puberty, children experiencing gender dysphoria may fear the beginning of periods, the growth of facial hair, or breast development.
For the first stage of medical intervention, it would be in the early stages of puberty. So we would start with a puberty blocker.
The use of medication to block puberty, to put it on pause, was pioneered 18 years ago by this clinic in Amsterdam.
We started for the first time treating transgender adolescents with puberty suppression to actually create time and rest for transgender adolescents. It was considered fully reversible treatment, so they had the time to make decisions about more irreversible parts of treatment.
It was another 10 years before the Tavistock Centre began prescribing blockers to children in the early stages of puberty. Many of their patients are aged around 15.
How do you, on the one hand, accept and support a young person's self-identification, whilst at the same time leaving things open? For us as a clinic, what it means is working on a case-by-case basis.
Jade was a patient at the Tavistock Centre 2 years ago when she was 16. She hasn't taken puberty blockers.
There's just so much thinking that needs to be done before making life-changing decisions further down the line about like hormone blockers when there are so many changes happening in your body and life.
The drugs are said to be reversible, but there's emerging evidence they may have more long-lasting effects in other parts of the body.
They are fully reversible in the sense that if you stop taking the puberty blocker, then your pre-programmed sex hormones will resume and you will continue to develop. Is there an impact on brain development in some way that has longer term implications? And we don't have the answer to that.
Doctors do their best to advise patients, making important choices about their care based on the best available evidence.
You know, gender dysphoria is a distressing condition. One of the key issues is to be able to say to parents and children is here's an informed decision based on the evidence.
I'm in Oxford to visit the university's Centre for Evidence-Based Medicine. Panorama asked the centre's director to review the most up-to-date research from across the world into outcomes for children and adolescents. What does the medical evidence actually show? He began by posing some basic questions.
What does it say about the benefits? What does it say about the harms? Have I got sufficient sample size? Well, the answer is no. Have I got sufficient evidence with quality? Well, the answer is no. And based on all that, can I make an informed decision? Well, the answer is no. 3 different areas where you look at the evidence and just say it's not fit for purpose.
Puberty blockers have long been used to treat children with a condition that means they start puberty way too early. Less is known about the long-term safety of their use in transgender medicine.
If you ask me about puberty blockers, what can you tell from the evidence? You can tell very little, apart from they give you the intended effects in terms of blocking and suppressing puberty.
Ten years ago, doctors concerned about this lack of evidence asked Professor Neil Evans to study the effects of puberty blockers in sheep.
We could see differences in the size of different areas within the brains associated with whether they had gone through puberty or not gone through puberty.
So having the blockers change the anatomy, if you like, of the brain?
Absolutely, yes. So we're now increasingly realising that at the time of puberty, our brain changes quite a lot. If we change the hormone environment that the brain is in then, that we're bringing about long-term changes in how the brain's able to work.
Puberty resumes if the drugs are stopped, but Professor Evans can't be sure how significant the changes he observed in sheep brains are.
So fully reversible, we're not sure where we are with that?
We don't know. There are a variety of different reasons why it's acceptable for these treatments to be given to these patients at this point in time. But no, we don't know what's going to happen. So it is in some ways a live experiment.
The Tavistock Centre agrees there should be more research, but say they also have to manage risks.
There are questions around risk, but there's a reason why people have even begun to think about using something like the puberty blocker in young children. And so what you have is a real phenomenon, and that phenomenon is young people who are hugely distressed around their gender identity. And so some of the evidence I think that is important is that young people and families who have gone forward for this treatment are exceedingly positive about it.
Over the past 5 years, the number of children referred to the Tavistock Centre has risen from 468 to 2,519, an increase of more than 400%. Most of the children seeking help are biologically female but identify as male. No one knows why this is.
Perhaps there's something about the role of women in our society, and in some ways is it preferential to have a male role rather than female role. There have also been arguments around sexuality and whether for some of these young people in the future the outcome will be around sexuality rather than gender.
She ran like a boy and walked like a boy from the earliest possible age. She wouldn't entertain anything feminine or pink, and she actually said that she wanted to be a boy, that she was a boy.
Fiona, not her real name, says her son experienced gender dysphoria from an early age. At 11, he was living as a boy and being treated with puberty blockers at the Tavistock Centre, but he was still distressed.
My son noticed that his friends at school were progressing through puberty naturally, with bodily changes and voice changes, and he wasn't. Comments would be made, and he felt incredibly uncomfortable and sank into a deep depression.
Aged only 12, he wanted to begin treatment with the male hormone testosterone, the start of a journey towards irreversible changes to his body.
He wanted more than anything in this world to be prescribed hormones in order to progress through puberty with his peers.
Hi guys, today I thought I would do a whole video on how I got onto testosterone.
I'm officially 6 years on testosterone.
Not all trans people go on hormones, but I always knew I wanted to, and I fought very, very hard to get it.
The NHS advises that only young people who've been taking blockers for a year and are aged around 16 can progress to hormone treatment with testosterone or estrogen. The Tavistock Centre told Fiona her son was too young, so she looked elsewhere.
I managed to find a private doctor, Helen Webberley, who was prepared to hear us out.
Dr. Webberley runs Gender GP, the only private clinic in the UK offering care and treatment to children and young people. To many in the NHS, she's a controversial figure.
The NHS say that you have to be around the age of 16 to have gender-affirming hormones. And I think our UK children, some of them find that very difficult. I think children should be allowed the second stage of treatment, which is gender-affirming hormones, when it's right for them and the family and their situation. And that might be before 16.
Following consultations, counselling and tests, Dr. Webberley prescribed testosterone to Fiona's 12-year-old son.
He would come home from school and he'd be on cloud 9 and say, Mum, my friends have said my voice has dropped.
But not everyone was so pleased. Complaints from other doctors about cases like this have in part led to Dr. Webberley's suspension from the medical register. At the moment, she can't practice as a doctor, but others in her clinic can.
What would you say to your critics who would say, you're assessing people too quickly, you're giving medication in a way that the NHS doesn't? What makes you think you're right?
I know I'm right because of all the patients that we've treated telling us that what we're doing is right. The outcomes are good. This isn't brand new. But what's developing is a much more gender affirmative approach, and that's what Australia and America are using very successfully.
I would feel concerned about introducing a less reversible treatment that has long-term implications at a much younger age. For us, it's about ensuring that there is time and space for proper exploration before taking any irreversible steps.
With more and more young people seeking referrals to the Tavistock Centre, waiting times can now be anything up to 18 months. It creates pressure for families and their children.
A lot of people assume that once you come out, that's the hard part's over.
Ruben transitioned when he was 24. Jade's been going to his support group in Leicester for years.
It still can be incredibly frustrating for young people, can't it? And I think particularly if you've waited a long time already to come out, because if your family aren't going to be supportive, or it's taken you a long time to find the courage to come to this decision to move forward, and you're kind of like, okay, yeah, I'm ready to start my life now, and then you find out that there's this potentially 2-year wait, it can be quite crushing.
There are many transgender children who come to us already in puberty because they've been waiting a long time on the NHS, or they've just been referred to the NHS, but the waiting time is going to be up to 2 years, who are very distressed, who are saying, please stop me developing any further, I cannot bear this.
But what would you say to people who are waiting on the waiting list now?
I think, of course we can always support people better, and ideally there wouldn't be the waiting lists. It's not a simple question of more funding, but unfortunately, with the best will in the world, you can't magic up specialists in a highly specialist area. Local services need to be skilled up to be supporting young people.
Make some noise for Jade!
Is starting to change. It's distressing to hear that you'll have to wait a year or more than a year to be seen. But I understand the wait because it gave me a lot of time to think about what I wanted from Tavistock.
Jade waited a year to be seen by the Tavistock when she was 15. She'd had a traumatic childhood and thinks the time helped her process her feelings and prepare for counselling.
Therapy helped me talk about not just gender stuff at Tavistock, but talk about everything. I took a lot of time playing with my identity, which I think is an important thing to do, especially for young people, because it gave me that time to realise that, I lived my life as a feminine guy, but that wasn't it. That there was something more to it. But if you just take off your mask.
But I've spoken to parents who fear waiting, worried about what might happen if their children go through puberty in the wrong gender.
My son was prepared to take his own life because he wasn't living the life he was meant to be, or who he was.
I think for parents, there is this idea that if my child comes out as trans, they're automatically going to start self-harming. Their life is going to be doom and gloom, when actually that's not necessarily the case. And the more that we do to support them, the less likely we make it that they're going to have those horrible experiences.
There's some research suggesting young transgender people are at an increased risk of suicide. But the Tavistock says current statistics should be treated with caution.
I think the figures around self-harm, suicidal ideation and indeed suicide need to be interpreted with great caution. I think for families who have a child experiencing gender dysphoria, often the way in which statistics can be presented can lead perhaps to an assumption that the panacea to this, if you like, is to start physical treatment as quickly as possible. And our experience would be that that just isn't the case.
The relationship between gender identity and mental health issues can be a complex one.
I had a parent come to me quite recently and say, my child's been self-harming and they told me they're trans and I don't really understand it, but I supported them. And then the self-harm hasn't stopped. Why hasn't it stopped?
I'm still struggling with depression, anxiety and gender dysphoria. I'm coping. I'm not self-harming as much. After the sessions I was realising that talk about everything that I've been through, it made me realise for myself how strong of a person I am.
But some clinicians worry about patients who want to go straight to medication without talking first.
I've become increasingly concerned about the large number of patients who want to be referred on for physical treatment, medical or even surgery, as quickly as possible.
John, not his real name, is a child psychotherapist. He doesn't want to be identified and says there's growing pressure not to question young patients.
So they come with a variety of different presentations, very highly anxious, school refusing, real difficulties with peer relationships, depression. They don't want to explore that, and they feel that once their gender is sorted out in their mind, that all of those problems will go away. I think what we see is a wider environment that's very negative about any exploration and often see it as a delay. Why are you asking that? I know exactly who I am, and how dare you ask that?
Over at the Tavistock Centre, some clinicians have resigned. They're worried about the impact of increased demand for the service and the reliability of research for the treatment and care on offer. Former insiders who didn't want to go on camera claim they felt rushed into green-lighting medical interventions. This is what they told me.
For some, I was fairly certain transitioning was the right course of action, but in the majority of cases, I was simply unsure how well things would work out for them in the future.
Research is being conducted, but we are many years away from fully understanding the long-term outcomes from the interventions taking place today.
Counter to child development theory and knowledge, this service changes children's bodies with the aim of improving their mental health, which mostly does not seem to work.
So serious are the concerns that the Tavistock Centre ordered an internal review. Its findings hadn't been published when we interviewed Dr. Carmichael. You've had an internal review. Are you able to share its findings with me?
I think it's just about ensuring that the structures around the service are robust and supportive for staff working in the service, but also that we don't compromise on the care that we provide for the young people coming to the service.
The review is due to be published next month, but some staff who've already seen it say it doesn't go far enough, and they're demanding an external inquiry. Gender clinics around the world are realising they need to do much more to find out what happens long term to the children and young people who come through their doors.
What we don't know is how will they look back when they're in their adult years. Do these adolescents, do these parents realize what sort of treatment they are getting and how far-reaching the effects might be lifelong? Are they able to have long-term relationships? But also, what about their wish for children? And that, I think, are really questions we don't have an answer yet.
The Tavistock doesn't have all the answers either. Do you think Tavistock has done enough?
They haven't produced systematic data on the outcomes based on all children. In the absence of evidence, I just do not understand how they can inform children, adolescents and parents and families in a way that helps them make an informed decision.
The Tavistock Centre now plans a new research project to record what happens to all its patients as they grow up, whether they're prescribed medication or not.
We've just received a very large research grant specifically to follow young people who come to the service through and forward, whatever their outcomes, and that's going to be really important information.
But is that enough? To make sure these life-changing decisions by children and their parents are based on the best possible evidence in the future, Professor Hennigan says this area of treatment and research needs regulating now.
It's incredibly hard, though, when you're in these emotive situations for people to take on board evidence. We urgently need a new regulator that has oversight to provide a much more rigorous approach and robust approach to the evidence to help inform decision-making.
The Department of Health says it has no plans to introduce an independent regulator. NHS England says its policies are due for review, and it will consider the most recent evidence available. While I've been making this film, I've been surprised by how many people don't feel able to speak openly about this important area of medicine.
A lot of the time people don't feel confident enough to speak up because they feel like if they say anything remotely negative, they're going to be branded as a transphobic bigot, and anything remotely positive, they're going to be branded as a lefty, liberal, snowflake, social justice warrior. We're seeing the extreme sides of things, and it's meant that there's all this space in the middle, all this grey area that's not being explored.
It can have a chilling effect on doctors.
Not every doctor that I know of really wants to be involved in this type of care. It's because there's so many opinions about it. It's delicate. People criticize the care we provide. So it's, yeah, you're sort of in politics as well.
At the moment there is a febrile debate, I think it's fair to say, going on, and I think, you know, it has become more polarised. It's a really difficult space then for families and young people to be part of, and I really hope moving forward that we can find some way of debating some of these contentious issues.
Jade's now back on the waiting list at the Tavistock, this time for the adult service. She says she feels ready for the next step in her transition.
And when she's leaving your home, you're begging her to stay. Doing stuff like this helps because it's like if I can do this big thing, I can do a small thing like riding a bus or like going to class every day. So it's doing big things to help conquer small things. I think that's what helps me. Thank you.
The future of care for young transgender people lies in the life stories of the young people themselves. It's only by following the journeys of Jade and others like her that we'll understand much more about the best ways to support them.